Hello everyone, I am Dr. Suraj Narasimhan, consultant interventional cardiologist and structural interventional specialist working in Narayana Health, Bengaluru. Coming to the risk factors for aortic stenosis, as we all know that aortic stenosis is predominantly a disease of old age. As we start growing old, there is a higher chance that this calcium deposition in the valve can lead on to stenosis. The second major risk factor for aortic stenosis is a disease called as rheumatic fever. This rheumatic fever is actually a disease which affects in the childhood, but then later on it can develop into valve narrowing like aortic stenosis, and also the other valves are also affected in this disease. Predominantly mitral valve is also affected. The third important risk factor for development of aortic stenosis is because of the lifestyle. When the patient is a diabetic, when the cholesterol is high, and if he is smoker, then there is a higher chance that these patients can develop aortic stenosis. The fourth risk factor for development of aortic stenosis is because of prior chest irradiation. We all know that radiation therapy is one of the treatment modalities for cancer. When a body, especially the chest area, is exposed to such kind of treatment with radiation, there is a higher possibility that these patients can develop aortic stenosis on a later stage. And the other important risk factor for aortic stenosis is actually a birth defect. Usually, all human beings are born with tricuspid valve, that is called as three cusps are there in the aortic valve. But then, due to some congenital abnormality, some people can be born with two cusps alone. So that is called as a bicuspid valve. The other kind of abnormality which is much more severe is they will be born with a single cusp. So that is called as unicuspid. These patients who are born with this bicuspid or unicuspid valve are more prone to develop aortic stenosis, and they develop aortic stenosis at an younger age when compared to people with a tricuspid aortic valve.